Welcome to our channel Hashmi Clinics.
Welcome to our masterclass on Antimonium Sulphuratum Auratum. We're about to dissect a really powerful but, often overlooked mineral remedy. Our whole focus today is on getting that precise clinical picture and nailing down the keynote symptoms that will let you prescribe it with real confidence and accuracy. So let's start right where the masters, Boric and Clark, pointed us. This quote tells us immediately that we're dealing with those deep-seated, really lingering catarrhal conditions, the ones that just refuse to resolve on their own. So here's our game plan. We're going to approach this systematically, just like you would with a thorough case analysis. We'll kick things off with the remedy's core essence, then we'll build up that constitutional picture with its mental and general states. From there, we'll pinpoint its key organ affinities, see how it all applies clinically, and then finally, we'll differentiate it from other remedies to make sure our prescribing is spot on. Right, let's get into the fundamentals. Understanding the source and the chemical nature of a remedy often gives us our first big clues to its clinical action. Okay, so what are we actually dealing with here? Chemically, it's the golden sulfurate of antimony. Now, that combination of antimony and sulfur, well, it gives us immediate clues. You get this dual action on both the catarrhal states, which is so common to the antimonies, and those separative processes we so often see with sulfur. And this brings us right to the central axis of the remedy, the one thing you've got to remember, that inseparable connection between the respiratory system and the skin. Seriously, when your patient walks in with an unresolved chest complaint and they also have pustular acne, Antimonium Sulphuratum Auratum has to be high on your list of differentials. Okay, now that we've got the essence, let's move to the constitutional picture and see how this remedy actually shows up on a mental and general level. Now, pay close attention to the powerful time modality here. There's a marked aggravation of symptoms, especially that mental restlessness and anxiety, right upon waking around midnight. That is a grade 1 guiding symptom for this remedy. And that oversensitivity during puberty, it just reinforces the connection to those hormonal-driven skin problems we already noted. The general state is just one of low vitality, fatigue, and messed up digestion. This almost complete loss of appetite, that loathing of food, and the characteristic pasty metallic taste, these are common threads you'll see running through the antimony remedies. It really points to a general sluggishness of the whole system. Okay, now let's explore the specific systems where this remedy really has its most powerful and characteristic action. Where does it love to work? And it's no surprise here. The primary spheres of action are unequivocally the lungs and very specifically the upper left lobe and the skin where it shows up as those characteristic pustular eruptions. This twin affinity is the absolute central axis of the remedy picture. This slide just perfectly illustrates the pathology underneath it all. We are not dealing with a violent, acute inflammation here. Instead, it's a state of passive venous congestion. And what does that lead to? The production of thick, ropey, tenacious mucus that is incredibly difficult to cough up, especially from its favorite spot in the left upper lung. That's the essence of the chest complaint right there. Clinically, this is a vital indication. This is your go-to remedy for pneumonia where resolution just fails to happen. The stage of hepatization becomes chronic and the lungs simply won't clear. The acute phase is long over, but the patient is left with this lingering, unresolved congestion. This is its classic territory. And the skin symptoms, they perfectly mirror the internal state. It's a tendency towards suppuration and unresolved inflammation. The hallmark is that pustular acne, often with hardened bases. And take note of that peculiar location of pustules on the scrotum. That's another really strong confirmatory sign. So this catarrhal state doesn't just stay in the chest. It extends upwards, creating a whole picture of mucosal inflammation. We find chronic nasal catarrh with a loss of smell, and that sensation of a plug in the throat. But also, look at the serious eye pathology, including commencing amaurosis, that's a partial or total loss of sight without any obvious lesion in the eye itself. It shows you just how profoundly this remedy can affect the nervous system. And here we have it, a classic, strange, rare, and peculiar keynote symptom, a nosebleed that happens specifically while washing the face. Think about that. It's not a common symptom at all, and its presence is an incredibly strong confirmation for the remedy. Discovering these unique keynotes is what elevates our prescribing from just routine to truly precise. The digestive disturbance really reflects that overall sluggishness we saw in the generals. You've got notable sensitivity in the abdomen, and these very characteristic stool patterns that can help confirm the remedy choice, especially when that respiratory picture is also present.
Okay, so let's synthesize all these symptoms into a practical clinical prescribing model. We'll focus on the key indications and modalities.
So these are your big ticket items. These are the primary conditions where you should have Antimonium Sulphuratum Auratum right at the front of your mind. If you encounter a case of lingering pneumonia, chronic catarrh, or some really difficult acne, this remedy should absolutely be on your differential list.
The modalities give us those sharp defining features. That aggravation after midnight is such a profound general symptom. It runs through the entire remedy picture, from the mental state right down to the physical complaints. And again, that peculiar nosebleed on washing, that's a clincher.
Of course, to prescribe accurately, we absolutely have to differentiate it from remedies that look similar on the surface.
Now, this comparison is crucial. You have to pay very close attention to the fine details. For example, look at the timing of the nosebleed with ammonium carb on washing versus after washing. It's exactly that kind of tiny detail that confirms a prescription and leads to a really successful outcome.
All right, to finish up, let's distill all of this information into some actionable clinical tips that you can use directly in your practice.
Just follow these steps in your case analysis. Think of it as your mental checklist. If you see this pattern of unresolved lung issues combined with pustular skin symptoms, especially with that left-sided chest focus, this remedy has to be strongly considered. So, the crucial takeaway today is this. Keep Antimonium Sulphuratum Auratum in your clinical toolkit for those difficult, stuck respiratory cases, especially when the skin is there confirming the internal pathology. It is such a powerful tool for unlocking resolution where more common remedies have failed, and it can turn a chronic, lingering case into a successful cure.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, Respiratory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.